Let me tell you why somebody should bother getting screened for lung cancer. Because the first thing is it could save your life, right? It could help the doctors catch it early if you have it. It is easy. You can get a low dose CT screening. You do not have to spend a lot of time, and you're in and out and you get your results.
We can't say it enough on this World Lung Cancer Day. Get screened for lung cancer. It can save your life. One of the things that LCFA, Lung Cancer Foundation of America, does so well is advocating for and educating people about lung cancer.
For example, recently we did a LCFA Hope with Answers podcast on adjuvant therapy. Now, this is a drug therapy that is sent throughout your body, and basically it grabs and destroys any bits of cancer that might be hiding.
As Dr. Jonathan Villena Vargas explains, adjuvant therapy is designed to help prevent a recurrence of lung cancer.
Dr. Villena, tell us, how do you describe adjuvant care?
So adjuvant care literally means anything after the primary maintenance, which in my case, or in most cases, would mean surgery. So you do a surgery, you remove almost all the tumor, and adjuvant care is to get rid of the micrometastatic disease, the stuff that we can't see, that we cannot surgically remove, with an idea that if we remove that, then it'll prevent the cancer from coming back. There's different flavors of this. As you know, the treatments are things like chemotherapy and novel treatments like immunotherapy or targeted therapy.
And Dr. Villena, sometimes we hear a doctor or a medical professional say neoadjuvant or just adjuvant, or sometimes perioperative or periadjuvant. Are these different phases or different kinds of adjuvant care? How would you describe that?
So neoadjuvant is actually a slightly different strategy. So neoadjuvant is given before surgery. So the idea behind, at least originally behind neoadjuvant, was that you could potentially shrink the tumor that may make a patient that is not surgically resectable now become surgically resectable. And that's kind of the idea. Now that definition has slightly changed with the newer therapies, in which, this with immunotherapy specifically, neoadjuvant may actually work better than adjuvant for the micrometastatic disease. So it's not so much about shrinking the tumor anymore, but it's more about kind of overall care of the patient so the disease doesn't come back after surgery.
Dr. Villena, before you go further on perioperative and adjuvant, could you surgically resectable? That means that you can cut the cancer out. Is that right?
That's exactly right. So one of the things that, was kind of understood or studied before I even came into practice was this idea that certain stages require certain treatments. It's usually the earlier stages that you can surgically remove, because the cancer hasn't spread to these distant tissues that you really can't go and operate on the patient and start removing all these different cancers in different tissues. So it's usually defined to something that you can remove all the cancer or all the macroscopic or visible cancer during surgery. And that's usually confined to the earlier stage disease.
Today on World Lung Cancer Day, we are thrilled to bring you stories of patients who are truly living with lung cancer. Not only are they living, they're thriving. Take a look.
That you must take.
You gotta have that mindset that quitting is not an option. Give up? Who, me? Never. Stop? Who, me? Never. That's for the next guy. That's for the next girl. But not me. Why? Because I don't quit. That ain't how I do it. That ain't how I roll. I never give up.
You must understand that there will come a time in your life that circumstances are going to challenge you no matter what you do. But you must never give up.
Don't let the obstacles discourage you and make you believe that it's not meant to be. Pursue when it's hard. Pursue even when it would make more sense to give up.
Not you, champ. You ain't the one. Not you, kid. You ain't the one to quit. Giving up is not what you do. You got the wrong one here, baby, until you believe that, until you feel that.
This is how I live with lung cancer. I walk through the cemetery with my dog. I work full time. I listen to audiobooks, lots of Stephen King. I parent. I'm a volleyball mom, and I have fun with my friends, planning hangouts or trips. And I am grateful for